Hi there, it's Tammy here. And in this short video, I'm going to be talking about why I believe you should be training during pregnancy, not working out or exercising. So if you didn't know that there was even a difference between training and working out or exercising, then this video is absolutely for you. So you've probably gathered by now that training and exercising or working out are actually two completely different things. So exercise is essentially anything that you do that's not following a structured plan. Training, on the other hand, is a skill that allows your body and your body's ability to perform the exercise to progress and adapt over time. And even if you go to the gym and use the equipment there, unless you're following a structured plan that progresses and adapts over time, you're still just exercising or working out. You're not actually training. And group fitness classes fall into the exercise category. And if you turn up to your PT and they just throw different workouts at you each session, I'm sorry to say, you're actually not training, you're working out. Now, even a hard or an intense workout is still considered exercise if it doesn't have intention or progression behind it. And I'm going to be controversial here and say that I don't believe that the generic one-size-fits-all pregnancy workouts, online classes, ebooks, free exercise videos, and swipe to train, they're all exercise. They're not actually considered training. So training has a clear goal and requires you to have a systematic plan or a program to force your body to adapt and respond to stimulus, to recover and increase your capacity, your strength, or your ability to perform each exercise over time. Your body's ability to adapt and respond to training stimulus doesn't suddenly change or stop because you fall pregnant. During pregnancy, you can progress. You can increase your training capacity. You can increase your strength and your ability to perform each exercise with correct technique. But to do this, you need to be training, not exercising. Now, a training program typically involves progressive overload, skill progression, exercise progression over time, as well as tracking your progress over time. And now this is something that I call individualized exercise prescription that's correctly timed, sequenced, and adjusts over time. And I firmly believe that this is actually what the pregnant body genuinely requires. Now, training also requires you to have a mindset in alignment with your goal. There has to be a desired outcome, a reason why you step into the gym to follow your training program. And this is especially important for the pregnant population, as they just have more to overcome than the general population before even stepping into the gym. Things like fatigue, morning sickness, various aches and pains, physical changes, and that's just to name a few. You know, the general population just doesn't have that. And personally, I believe the goal when training during pregnancy should actually be to minimize the physical impact of postural changes, changes to the abdominals and pelvic floor function, and to remain as pain-free and mobile as possible throughout your entire pregnancy and postnatal journey. All the while increasing in strength to help you cope with the increased physical demands of your pregnancy, the demands of the birth itself, and life beyond that as a new mum. And I don't believe that you can achieve this through exercise or working out alone. As a strength coach, from my perspective, you should always be aiming to train as opposed to exercise or work out, but especially so during your pregnancy and your postnatal journey. Now, bearing in mind that the why behind this goal is always going to be different for every single person. And of course, there are going to be conscious and unconscious reasons for that particular why, for that goal. And of course, these can range from everything like fearing the birth or fearing the unknown or whether you can cope with the birth, the health of your baby, your own health, minimizing or managing pregnancy complications and health problems that arise during pregnancy, concerns around how your body is changing, concerns around how your relationship will change, and whether your partner is even going to still find you attractive once you have the baby. your expectations around the birth and being a parent, and of course stress management, because, well, you know, pregnancy can be a pretty stressful time. Now, obviously, these are just some examples, and this list can go on and on because each person's motivating factor, their why, is going to be unique to them, as unique as their body, their pregnancy, and their pregnancy experience, as well as their training experience. Because the reality is, everybody is different. Every pregnancy is different, not just from person to person, but the same person will experience each pregnancy differently. And only recently, I actually had a pregnant client swear black and blue that she was having a boy because her pregnancy was just so different from her previous pregnancy, only to discover that she's actually having another girl. And this pregnancy is just, well, I don't know, different. Now, because of this and my experience as a strength coach who's worked one-on-one with the pregnant population for over a decade now, from my perspective, and I'm going to be controversial here, providing a one-size-fits-all workout to an entire membership base, entire channel, or anyone who lands on your free page, to me is just illogical. We're all different. We all have different biomechanics. We have varying ranges of mobility, vastly different injury histories, different muscular imbalances, and every woman falls pregnant at different points in their training journey. Or more precisely, they have different training ages when they fall pregnant. And this, of course, affects things like muscular development and neural adaptation. And all of this is a major factor in exercise selection. I mean, just think about this for a moment. Would you give the same program to someone who has never lifted a weight before, where you actually need to teach them new movement patterns, to someone who has 10 years training experience and already has these patterns ingrained in their central nervous system? I mean, all of these factors are considerations when training, but they're not considerations when you're exercising or working out and following the same program as Debbie down the street. Poor Debbie, she's getting a hard time. Now, because everyone is different and every pregnancy is different, some things are going to work well for some and not for others. And how they respond to training will also be extremely different based on things like genetics, age, experience, and when it comes to pregnancy, so many other factors that influence their training programs, right? Or your training programs. On top of all of this, from my perspective, the way that women train has changed, you know. No longer are we relegated to just doing cardio, just doing group fitness classes or lightweight circuits, you know. You walk into most gyms these days and there are strong, powerful, capable women training with some serious intent and intensity. And we've also had some really amazing advances in how women actually approach their pregnancies and their birth paths. And I'm sorry to say this, I just don't think the one-size-fits-all approach cuts the mustard anymore. And personally, I actually think that it's a little irresponsible to generalize exercise selection for huge groups of people, but especially the pregnant population where there are so many factors at play. I mean, can this same program really be applied to someone who has never lifted a weight before, a casual gym goer, and to someone with years of strength training history? Now, will the prescribed exercises, reps, and sets be appropriate for all of them? Another question, does the program include progressive overload? And remember, this can be done in a number of ways, of course. You know, it doesn't just need to be limited to increasing weight. In fact, this is especially important in the pregnant population. Now, if you're doing a group exercise class, exercising or working out, then the answer is likely no. This also means that your progress and your results are going to be limited because for both of these, you need a fundamental principle of program design called progressive overload. And you know what? You don't actually have to look that far to find research examples that prove response to standardized exercise varies dramatically, right? I mean, one study showed that a variation from no change at all, like non-responders, to a 50% increase in cardiovascular fitness when given the same dose of standard exercise, right? I mean, that's pretty friggin' huge difference if you ask me, 0 to 50%, right? Now, similar kinds of results can be seen in studies done around strength training. I mean, granted, these are done in men, but these studies showed a variation from a 20% increase to a 2.5% decrease in muscle size when following the same exercise 3 times a week for 9 weeks. So as you can see, the variation between everyone when doing the same exercise is massive. You know, negative 2.5 to an increase of 20%. These studies not only highlight why it's so important that your exercise prescription is individualized, but it also shows that there are always going to be outliers when it comes to the one-size-fits-all approach. And this is taking one specific area of training into consideration, not all of them. And when it comes to exercise during pregnancy, you know what? There are so many factors to consider. And a huge one is actually rapid physical changes that a woman goes through and the effects pregnancy can have on your body. And I guess what I'm trying to say is things happen, right? One day you might not have any pain and the next you've developed something that your training actually needs to take into consideration, right? And the issue that I see with the one-size-fits-all approach or working out is that it doesn't allow for ongoing adaptations to exercise during pregnancy that it genuinely requires. And for those who fall into this category, how are they meant to navigate these sudden changes when they don't have the knowledge or the experience or the education to actually work around them, right? And the common answer that I've come across for those facing these kinds of problems is that they actually stopped exercising altogether. And this is the worst outcome of all. So if you want to ensure that you're training during pregnancy, not just exercising or just working out, then you know what? Head to the link in my bio and apply to join my complimentary but private community. So that's it from me today. I hope this video helps and I'll see you in the next one.